Broadcasting from the business capital of the world, this is the Podcast Business News Network. Welcome back to the show. We're joined by Dr. Stephanie Bathurst. Excited to have her here from beautiful Hawaii. And welcome back. How are you?
Thank you. I'm doing well. How are you, Jill?
I'm doing great. I'm excited for our holistic therapy talk today. Before we get into that, would you mind just telling us your website, how we can contact you, and just a little bit about the work that you do, and then we'll get right to it.
Yeah, absolutely. So I own a private practice in Oahu, Hawaii, and it is Bathurst Family Therapy, LLC. You can find us at bathurstfamilytherapy.com. Our phone number is 215-501-7452. You can contact us also via email at help@bathurstfamilytherapy.com. We do clinical sexology, relationship therapy, holistic healing for mental health.
Great. And that's what you want to talk about today, holistic mental health. Could you explain to us exactly what that is?
Yes, I love this topic. I'm so excited that we're talking about it. So holistic mental health is a particular field of therapy or medical treatment that uses natural or non-pharmaceutical methods to treat mental health difficulties. So people come to me looking to naturally treat ADHD, mood disorders, anxiety, insomnia, brain fog, irritability, low sex drive, things like that. And the focus tends to be on healing the root issue or the root problem rather than on like alleviating or lessening the secondary symptoms of the problem. And sometimes the root isn't always seen, so we have to do a little bit of investigative work.
Got it. Okay, perfect. So you mentioned lifestyle changes. You recommend that, right? Some exercises for clients.
Yes, absolutely. We want to break down what routines are serving them and not serving them. I also prescribe herbal supplements as a holistic provider through Full Script, Human, Whole Script, Zymogen. So just more holistic providers. So we'll kind of do like a comprehensive environmental evaluation and see if there are chemicals or preservatives that are negatively affecting you, any EMFs that are negatively affecting you, and then kind of wrap it all together with some holistic herbal supplements to help your body heal.
Great. Well, what does it look like for you to treat anxiety?
Sure. Yeah. So this is a really common presenting issue. I think especially after COVID, where most of us were kind of like cooped up with one another and got really unfamiliar with social interactions. Anxiety, in particular, social anxiety, is really, really prominent right now. So anxiety is a huge umbrella with many, many underlying causes. We want to make sure that we find out what the root problem is. So anxiety can be a secondary symptom to underlying chronic sleep disorders, PTSD, and even medical issues like POTS, which is it's like a postural orthostatic tachycardia. It's kind of like a circulation disorder, right? So when I'm meeting with a new client, I would like to ask things like, are you feeling wired and tired, to kind of evaluate if we have some adrenal fatigue that's playing a role in the anxiety. If you're having some imbalances in stress hormones, if you have GI issues, because that might mean that maybe we're having some microbiome or gut imbalances. And we know that most of our neurotransmitters are actually produced in the gut, not in the brain. So things like that. We discuss psychological barriers like negative self-talk, future predictions, or dysregulated mouth breathing, all of which can reinforce anxiety. So there's a lot to talk about when we're treating anxiety.
And what would you offer for treatments to anxiety?
Yeah, there's a lot, and we want to personalize it to the client, so it's not like a set protocol, right? We kind of cherry pick what we feel like is best fitting with the client's needs and responses. So the anxiety responds really well generally to fermented foods and probiotics, to supplementing with a really good quality methylated B complex. Human has a really good one that I really like. It's a melty, it kind of tastes like cotton candy, which is lovely. Vitamin D, glutamic acid, inositol, really good omega-3s, And Formula 303 actually has a fantastic compound. It's a concoction of hops, passion flower, and valerian, which are three herbal supplements that are recommended for treatment of anxiety. So if you want to just kind of take Formula
Okay.
303, it's a great additive to your daily routine.
Awesome. And speaking of daily routine, is there certain foods that maybe we should be eating that could help us treat anxiety?
Yeah, definitely. Anxiety is kind of quelled or managed through functional medicine pretty easily. So if you just integrate more spinach, beans, oats, liver, walnuts, if you want to drink kava, milk, green tea, valerian root and passion flower tea, because there are some really yummy concoctions out there. Really, any kind of nervine or adaptogenic tea is going to help your body kind of relax, get out of that sympathetic nervous system response and kind of regulate itself. So those would be the integrations that I recommend for anxiety.
Awesome. And what do you do when a client comes in requesting to manage their ADHD naturally? Is that something we could do?
Yeah, 100%. So first we, again, want to rule out any underlying causes. So complex PTSD, which if we're not familiar, is essentially like many small T traumas over an extended duration of time. So not like a car event, which is a traditional PTSD moment, a very big T trauma, but many concurrent small T traumas over an extended period of time is complex PTSD. Any circadian rhythm disorders, any food issues like allergies or hypoglycemia, all of them can manifest ADHD presentations, and the treatment for each of those totally different, right?
Okay.
So we want to figure out what's actually going on that is manifesting the ADHD first, because the treatment's going to be unique depending on that outcome. So a secondary form of ADHD can also manifest after a TBI. So that's kind of the rule out process as well. If we've had, if I have a veteran that's in my office, that's going to be certainly part of our evaluation. If there were any traumatic brain injuries that are part of their history, because again, that protocol, that treatment, totally different. Yeah. Dr. Mark Gordon has a really fantastic protocol for healing TBI, even if it's years later. And that can be really helpful in addition to more of the traditional and holistic ADHD protocols as well.
Did you want to share some of them or some recommendations in general for ADHD presentations?
Yeah, sure. So we usually recommend a higher than average dose of fish oil or krill oil just to get your omega-3s like up and in an optimal rather than functional level. So like between 1 and 5 grams of really good quality fish oil, especially in the US, our supplements aren't regulated very well. So we want to be very mindful about the brands of supplements that we are purchasing. So when we're talking about omega-3s, I would strongly encourage somebody look at Carlson Labs, Nordic Naturals, Life Extension, Thorne. For ADHD, liposomal L-theanine is also recommended. And there are certain essential oils that can really help, whether it's through a diffuser in a room, or if you probably have one of these, right? Like the little beads that have clay beads and you can drop essential oils on them.
No. What is that? I don't even know what that is. Thank you
Oh,
for sharing.
they're so great. You can get like lava beads and you just drop essential oils on them and they diffuse the essential oil throughout the day. They have necklace pendants as well, but they're really beautiful and they do the job. So you're not having to wear it on your skin and apply it frequently. The beads hold the essential oil for longer durations of time. They're pretty awesome.
Oh, cool. Where can I get them from?
I think anywhere. Etsy definitely sells them.
Okay, cool.
A lot of the crystal shops will have them. So just look around. I'm sure Amazon has them as well. Yeah.
All right. So, is there certain foods for ADHD that we should be eating?
Yeah. So for ADHD, we definitely recommend high fat and high protein diet, low sugar, low carb diet. So think like keto Atkins kind of protocols, right? And L-theanine that we had mentioned earlier can actually be taken with some level of caffeine. If you're wanting a synergistic effect, they kind of blend really nicely together and amplify each other when taken at the same time. For ADHD, we can also integrate red light therapy techniques to help calibrate any underlying sleep disorders. I actually own a Juve machine, which I love. It's fantastic. I have
Awesome.
polyarthritis, so it helps me manage my inflammation. But I know I have a home office in Oahu as well, and clients are welcome to use the red light machine while we're sitting doing sessions, so we're kind of multitasking. It's fantastic. Yeah, it improves circulation, reduces inflammation, helps activate the light sensors in our body to get our circadian rhythms back in order.
Oh, it's so cool. All right. What about some next steps you want to share with us? Reporting when someone reports trying multiple antidepressants without any effect, and or have too many serious side effects that they don't want to do that anymore. What would you recommend?
Yeah. So unfortunately, this is a really common problem. Um, if they haven't done so already, I would definitely ask them to get a full blood panel. And we can talk about what that means, like the actual notations to request from their doctor, or I just ask them to sign a waiver and I'll speak with their doctor directly. I am fully on board with provider collaboration. We want to work as a team to support every client rather than have the client be mediating between each provider, which is, very frustrating for them. So full blood panel, we do a walkthrough of their everyday life together. So their food, their sleep, mood, activity, relationships, stress, sex, routines, chemicals, thoughts, emotions, perspective, medical conditions, really everything. We try to suss out any patterns that might fill in information about their story. And then we also talk about conjunctive therapy. So if it's more medication resistant depression, then TMS or microdosing ketamine trials, which are provider-led, right? Like doctor-led treatment plans are actually really, really effective in treating medication-resistant depression for clients. So we talk about those options.
Okay.
And then if they have titrated off of all psychiatric medications and are looking for a more holistic route, we can certainly look at medications that specifically treat depression, like St. John's wort. We just want to be mindful because some of them do have contraindications for other things that are on the market, right? St. John's wort does not work well with depression medication. So you can't take them together. You have to be off of the medication first before taking that.
And what is St. John Wart's? What is that for? What do people take that for?
For depression, it's
They
specifically
do.
for regulating mood.
Oh, okay. I wasn't even sure what that is. Okay.
Yeah, it's really, really effective. But it does have a lot of contraindications for many, many medications in the pharmacy field. So we want to be mindful of what you're putting in your body and how it affects other things that you're putting in your body, which is why it's important to work with a provider.
Got it. And in
Yeah.
conjunction, you could do some other things. You mentioned the TMS, medication resistant depression. What's microdose ketamine trials? What does that entail?
Yeah, so it's exactly what it sounds. It's actually like consuming ketamine in your body to help your brain rewire a little bit differently. But you're doing it at such a specific and refined level in the dosing of it, and you're doing it under the watch and the clinical
Got it.
care.
I'm like, because I thought ketamine was a bad thing. That's why I'm like, okay, a micro dose of it. Okay.
It is a drug that people use recreationally, which can
Got
be
it.
in higher doses and make you a little high.
Mm-hmm.
In this particular context, you do it under the supervision of a medical doctor who is trained in the dosing. And you can do it, I think it's for most clients every like 6 months ish, depends on your body's responsiveness. But I've had many clients with pervasive severe depression, and that has been the only thing that has really like magically resolved their depression for them. We're grateful for that. Yeah.
Awesome. Now you also help those with sexual medicine, right? And that's one of your specialties. Could you share a little bit about that and that part of your practice?
Yeah, absolutely. So my scope of practice, we support sexual health and rejuvenation, and it can look like so many different paths. So helping sex hormones get to optimal levels rather than just functional levels. And what that means is I don't look at somebody's age and say that their sex hormone levels are normal because of their age, right? So if I have a 65-year-old woman sitting in front of me and her sex hormone levels are fairly low, right, in comparison to the optimal levels for youthfulness, for sexual satisfaction, for high energy, all the
Got it.
things that she's wanting to do with her body. Just because it's normal for her body at this age to be at that level of hormone, it doesn't mean that we want it to be there, right? We want it to be in an optimal level so that she's feeling better and can enjoy her quality of life.
And that can
So
be fixed?
yeah, absolutely, 100%. Unless there's an anatomical reason like a
Okay.
pituitary
Okay.
tumor, right? That would be something that we can't fix. We just have to adapt to.
Okay.
So we can amend those holistically by including amino acids, vitamin D supplements. Those are building blocks that your body needs to produce the sex hormones in the first place. So if you're deficient in any of those amino acids or vitamin D, anything like that, or if you're overproducing cortisol for whatever reason, all the building blocks are being consumed and are not able to be used for the production of your sex hormones, which is why you may be deficient in them. So we kind of tinker around with what your body needs to create them in the first place.
Got it. But you also can offer holistic prescriptions that naturally increase libido. Could you share what some of those may be?
Yeah. So there are a lot of options actually, and it really just depends on what the client is looking for, right? For traditional Chinese medicine, there are a ton of options. That's not
Okay.
really my specialty, so I stick more with um, Western holistic medicine, which I'm more familiar with. But for SSRI-induced sexual dysfunction, which I actually have a good amount of clients who come to me for that specific reason, right? I'm taking antidepressants, or I have taken them in the past, and my sex drive is almost none. What do I do about it, right? So it's a common presenting problem. So maca powder, saffron, rose oil, all of these are supported by evidence to counteract the SSRI response to sexual dysfunction. So those would be some of the prescriptions that I provide those clients.
And what about, I was reading in your notes, something about lozenges?
Yeah.
What are those?
So human actually has it's, you can take them in pill form or lozenges, either way is fine. And it's a nitric acid oxide lozenge, right? So it increases the nitric oxide in your bloodstream, which is necessary for increasing circulation to the sexual organs, which is all arousal is. That's all physiological arousal is. So I can prescribe Neo 40 to a client who is struggling with physiological arousal, which means like erectile dysfunction would
Okay.
be an example of that, instead of Viagra or Cialis, which can have really severe side effects for some people. And it works
Awesome.
really well.
Got it. And you mentioned better sleep hygiene routines as well from will happen because of this.
Yeah, absolutely. If our sleep is disrupted, our ability to replenish hormone levels is absolutely disrupted as well, because our sleep is where our cells kind of get our broken cells die off and we rejuvenate and replenish new cells. It's where we replenish our sex hormones. It's where we detoxify from the chemical compounds of stress from the day before. It's really critical. So we want to get your sleep regulated to have better sexual experiences.
Awesome. Good to know. And you mentioned red light therapy before, though. Did you want to add some more information on that as well?
Yeah, so red light therapy is most recently being used for sexual medicine. If it's placed directly onto, and these are for like 15 to 20 minute time frames a couple times a week. Red light therapy, by the way, is totally non-invasive, right? You can have your own machine, sit naked while you're watching TV for 20 minutes or drinking a cup of coffee on your back deck, right? Like it's a very enjoyable experience. There's no threat to it. Studies are showing that if you're using red light therapy directly on sexual organs for that period of time, testosterone levels in particular, if red light therapy is being done directly on scrotum, then testosterone levels are like skyrocketing naturally. Okay. Fantastic. So it increases blood flow and it increases sex hormone levels just with the application of it for non-invasive.
That's treatment. Like the hair. I looked into this hair laser thing to help my hair grow. Yeah. It's a red light therapy. So it's the same concept.
Yeah, because it
grows,
increases,
it stimulates.
100%. Yeah.
Interesting. All right. Really didn't know that. So you could buy like something from Amazon, or where do you get red light therapy from? How do you know which machine is like legit, you know?
Yeah. I have Juve machine. So you're looking for red and infrared light. So the machine that I recommend would have both of them because they serve different purposes. So yeah, just look around. They're not going to be the most inexpensive thing that you purchase, but you'll get your use out of them rather than going into a clinic and paying for sessions. I would just buy a machine if you're able to afford it, because you'll definitely make good use of it.
Perfect. And I know you wanted to kind of add in the end here a little bit about the work you're doing. You have a wholehearted, would you mind sharing a little bit about that?
Yeah, absolutely. So because I'm not a medical doctor, I'm a clinician, right? I'm a mental health clinician. I'm wholeheartedly in support and work in conjunction with other medical doctors. So urologists, OBs, endocrinologists, naturopaths, who are creating some really amazing things for sexual regenerative medicine, and things like stem cells, right, being directly input into reproductive organs and having some amazing advancements. It's really, really, really cool. And I feel really honored to be part of this field and to see the advancements happening as they come just in the last like 5-10 years. It's been really cool. So I'm hoping to collaborate and work with some more providers as we continue forward with, expanding and celebrating this fairly new field. The clinical sexology field is fairly new.
Awesome. And I know you want to leave off with some foods for sex.
Yes. Yeah. So foods for sex are going to be any foods that really increase like your circulation. So beetroots, right? Kale, spinach, cabbage, ginger, really foods that increase nitrates. And then if we're talking about like spices, any kind of cinnamon, nutmeg, clove is going to do that. Vanilla is going to increase sexual response. So a bunch of aphrodisiacs, as we call them.
Awesome. Well, thank you so much for being here. Dr. Stephanie Bathurst, tell us your phone number, location, offices, and how we can contact you.
Absolutely. Yeah. So you can contact us at 215-501-7452. And as well as email, which is help@bathurstfamilytherapy.com. And we have a home office in Oahu, Hawaii. We are offering couples retreats in person, 5-day couples retreats. Yeah. One-to-one sessions. Just feel free to contact us. We have a whole lot of services that we're offering, and we're happy to work with you.
Exciting. When's the next retreat coming up again?
June.
Is there still availability?
There is, yeah.
Tell them one more time. Tell the website again. Say it again, Dr. Stephanie.
Yep, bathurstfamilytherapy.com.
Perfect. Thank you so much. Great conversation today. Great topics, great information. And if anyone has any questions, please reach out to her. Feel free. She'll be there for you, and she'll take that call, and she can work with you on an initial consultation. Thank you again, Dr. Bathurst. Have a fantastic day and enjoy your weekend.
Thank you, Jill. You too.
Are you going to the beach?
Oh, of course, every day.
Jealous. All right, soon, one of these days. Bye, sweetheart. Thank you.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.